welcome to the second session of bone tumor. Here we are starting with the next question. Nidus is seen in. The options are osteoid osteoma, osteosarcoma, Ewing sarcoma, chondroblastoma. So basically nidus, which means a foci. So which of the following tumor is going to have or restricts its entire pathology within a small foci and not going to develop much in size? Obviously, as sarcoma is a malignant tumor, obviously it has to growth geometric progression. So osteosarcoma and Ewing sarcoma cannot be a good option, and chondroblastoma again is an aggressive tumor of the children's, and again it cannot be a better option. But still, the word nidus, the answer obviously for this question is osteoid osteoma, and the word nidus is also very characteristic for this tumor, osteoid osteoma. So with related to nidus, don't restrict just with osteoid osteoma, because there is one other condition which can again have a nidus. That condition is osteoblastoma. Both can have nidus, remember, both can have nidus, though we all know by repetition since our second year of MBBS that nidus is seen in osteoid osteoma, nidus is seen in osteoid osteoma. Remember, osteoblastoma can also have a nidus in it. Now, what is a nidus? Look, could you see a small foci? This is a nidus. Here, this is a nidus. And here, in the third picture, this is the nidus. So, what is a nidus? Nidus is an area of an osteolytic foci which is surrounded by an osteosclerotic margin. So, here there is an osteolysis here and there is an osteosclerosis surrounded. I will be erasing the ink, then you can see it very clearly. Yes. So, an osteolytic area which is surrounded by an osteosclerotic area. So, that is what nidus. But there are certain books which very much saying that a nidus need not just be an osteolytic area surrounded by an osteosclerotic margin. It can also sometime, especially near the joints, as in the second picture, it can be osteosclerosis surrounded by an osteolysis also. Okay. But as per generalized terminology, it is most of the time an osteolysis surrounded by sclerosis, but sometime it can be osteosclerosis surrounded by osteolysis also, and it is very common in osteoid osteoma. Now, related to osteoid osteoma, what are all the points you must be knowing? Remember, it is a solitary lesion, very rare for an osteoid osteoma to occur in multiple lesions. It is very commonly a solitary lesion. It is solitary lesion, but highly painful, very much painful. Why it is very much painful? Just think about it. Because the nidus what we are talking about is actually containing prostaglandins in it, and prostaglandin job is to create pain, is to create inflammation. So obviously osteoid osteoma will be very painful condition. Okay, so it's a very painful bone tumor. Unlike your osteochondroma is most of the time asymptomatic. No symptoms, no pain. Okay, but here it is very painful condition, and remember, it is a true benign bone tumor. Most common true benign bone tumor is osteoid osteoma, and it got nidus, N-I-D-U-S, nidus, and that nidus is usually less than 2 centimeter. Why this 2 centimeter cutoff is very important? Because I said nidus can also be there in case of an osteoblastoma, because if it is more than 2 centimeter, I can go the diagnosis as osteoblastoma. Clear? Less than 2 centimeter, osteoid osteoma. More than 2 centimeter, osteoblastoma. So nidus which is less than 2 centimeter is very characteristic. Age group, adolescent age group. And remember, most of the time it is self-limiting. It is painful, but if the person is withstanding those pain and without reporting to hospital and can go for some 2 years or 3 years, and after 3 years it limits on its own. So most of the time it is self-limiting condition.